Thank you, Mr. Chairman, and Madam Secretary, welcome back to committee. Thank you for being here. I have worked with several of my colleagues on this committee on a white paper which we issued yesterday, and it outlines concerns that we have about the electronic health record program that was created by the stimulus bill. And one of the chief concerns is that the program wasn't thoughtfully planned, and that CMS and the Office of the National Coordinator for Health IT are insufficiently focused on the issue of interoperability. And I'm also concerned that the Office of the National Coordinator has a philosophy that's focused on simply pushing federal taxpayer dollars out the door and using sort of the dollars out the door as a measure of success of the program without sufficient oversight of those payments. I'm wondering if you agree with that.
I do not.
Well, it's noted in our report that providers simply self-report that they've met the necessary criteria to receive federal incentive payments for adoption of health IT with no documentary evidence necessary. Your agency's Office of the Inspector General has warned that this is a potential problem. The Inspector General issued a report last year saying that Medicare, and I quote, does not verify the accuracy, end quote, of the self-reported information by health providers claiming the incentives prior to the payment, and even noted a few examples of providers who had reported themselves eligible but had not actually met the requirements. And so my next question is, do you agree that self-attestation is a problem in terms of them certifying themselves eligible?
Well, Senator, we take the adoption of electronic health records very seriously. I can't imagine any other industry which represents close to 17% of our GDP, which is trading information on paper files. So this is a significant move forward. We have about a third of the individual providers with another third in the queue, and almost 2/3 of the hospitals who are now in the process of adoption. I think that what has to be attested to, my understanding is, will be firmly able to be tested more thoroughly when the interoperability standards go live in 2014. As you know, in meaningful use stage 2, that is not yet up and running. There is a lot of concern. It is sort of the gold standard of electronic health records. If they can't talk to each other, it's really not a venture that takes us very far. We understand that. But it is not live and running, and it has been the focus of both the policy committee and the production committee from day one.
Well, and in responses to questions from this committee, Ms. Tavener, the nominee to head CMS, stated in written comments that there will not be a delay in implementation of stage 3. And I'd ask the question, but given that it seems clear that the leap to interoperability is not possible from the already existing requirements for stage 2 to stage 3, what are your plans for stage 3 that ensures taxpayer dollars are being wisely used to invest in interoperability?
Well, again, we haven't gotten to implementation of stage 2 yet, so you may be on you're reading the final chapter before we launch it. January of 2014 is when the portion of stage 2 that deals with meaningful use will be up and running, and I think we have full plans and a timetable to then move to stage 3, but we don't right now have a plan about what could or could not happen, because we need to fully implement stage 2.
But aren't the rules final for stage 2?
The rules final? Yes. Yes.
Okay, well, if in terms
But it's not up and running yet. The timetable hasn't been reached.
If the thing I guess I would say I'm concerned about, and this is the leap from the current stage 2 requirements, particularly with regard to interoperability, is going to be very difficult in terms of the challenge that's going to be faced by a lot of rural providers. And so my next question is, what are you doing to ensure that small rural providers' needs are being considered in terms of stage 2 and then ultimately stage 3?
Well, Senator, part of the framework of this implementation was really to create information and technology exchanges in every part of the country. And they are focusing most specifically on critical access hospitals and on small providers, knowing that the luxury to have a big IT department or have people who could implement this in a significant period of time were not there. So in every state, there are individuals who are sort of the, I compare them to the farm extension services, folks who are on the ground who literally come office to office, hospital to hospital, spend time on how to convert, what the best strategies are, how to be engaged and involved. And we have found, at least in a state like Kansas, which is not terribly different from the challenges I think that you see in your state, that strategy has been enormously effective, and small providers are engaged and enrolled with those extension operations and find them to be kind of their service team on the ground.
Well, the only thing I would say is I hope that as we move forward with this, that the focus really will be on the issue of interoperability, because we've asked questions numerous times at the committee here of folks who've testified in front of the committee about what's happening with regard to interoperability. And there may be that a lot of providers are creating their own health electronic records, but the idea that somehow they're going to be able to communicate with others is just, it seems to be non-existent in many cases. And so you've got these silos out there, but until they can talk to each other, we haven't solved this problem. And it seems like the focus of this, and that's why I say a lot of the money that's gone out the door, that seems to be the metric, instead of what are we doing to really, what's the metric, or what's the measuring stick for whether or not we're succeeding in the issue of interoperability.
Well, I would say, again, Senator, from the outset, and I would certainly agree with you that that has to be the sort of North Star of whether electronic records work. It's not whether paper files are in somebody's computer, but it's whether or not you can measure, share information across, not only across a state, but across a country and conceivably across a globe. So that has been part of the framework of the formula to look at what sort of IT systems would qualify, what the specs have to be. It's part of what has to be attested to, that a conversion to an electronic record system has to have the capacity to actually get to stage 3 and along the way and demonstrate that. It doesn't have to be part of the operating system from day one, but it has to have the capacity to add that on. They're very specific kind of specs as a part of the what qualifies for the incentive payments. So I think that has been part of what the technical committee that has been the advisor to the Office of National Coordinator from the beginning has been focused on, how at the end of the day you make sure that these systems actually work. We were strongly advised, Senator, and it came to at the dismay of, I'd say, some of the biggest IT companies, but we were strongly advised not to choose one system, not to have one winner in this market and everybody else a loser, but rather to focus on a series of specs that would, at the end of the day, make sure that these systems were interoperable, but then allow providers and hospitals and others to either make conversions of the systems that they had, or purchase any variety of new equipment. And that's really been the framework, to have a more open source, but certainly with interoperability at the end of the day.
Well, and I don't know that there's, I'm glad to hear that you're focused on these specs. I don't know that these specs exist. And again, the self-attestation model that's being used seems to lack the kind of documentary evidence that the folks who are eligible for some of the assistance that's coming with this are actually focused on these right metrics that you're talking about. Because, and so I guess something I would say in conclusion is that, you know, we look forward to engaging with you and your department on this, and we're going to continue to solicit feedback from stakeholders about where they are, and I think this report that we put out will maybe put a fine point and an additional focus on that. So, thank you.
Thank you.